Welcome to the WOW Show Careers Guides. This is all about therapeutic radiography, one of the 14 allied health professions. It's one of those jobs not many people know about, and it's an incredibly rewarding and special career. As you'll hear from Daniela and Sarah, it's a job that combines caring for people with great communication skills and cutting-edge technology. Let's find out more.
A therapeutic radiographer is somebody who treats cancer using really high energy X-rays. We are kind of part of the patient's cancer treatment process, and we will meet the patient when their cancer has been diagnosed and when it's been decided that radiotherapy is an appropriate treatment.
There's days when it is tough and sad things do happen, but the majority of our time is spent so happy and so upbeat. It's such a positive environment. It's really exciting at the minute because there's so many avenues that you can go down as a therapeutic radiographer. There's lots of radiographers that specialise in prostate cancer or breast cancer, head and neck, lung, everything that you can think of. There's a therapeutic radiographer that specialises in that role. And not only just with like anatomical sites, but because our role is so dependent on technology, there's lots of different technological roles that you can have.
You can go into management, you can go into being a specialist in imaging, you can go into being a specialist in a certain type of cancer, and there's just so many different pathways, although they're all within oncology, cancer, radiotherapy.
At university, it tends to be split more or less 50-50 between your academic time, so the time that you spend physically at university, attending lectures and on placement. But having that on-the-job learning is so important.
My degree was radiotherapy and oncology. There's lots of different parts to the degree, so it's quite a nice one to do if you know you like science or you know you want to go into something with people. My course had a large amount of placement versus university. So I probably did 60% placement time in a hospital, literally working with people who were doing the job I was qualifying to do.
Before I started on the course, I approached the local hospital that had a radiotherapy department, and they were super happy to have someone interested. And I actually did 3 days in the department. What the universities tend to do is they tell you to start looking for jobs as you're coming to, I'd say, around the middle of your final year. So a lot of the time, people are finishing their degree with a job ready to go into.
I've been lucky enough to experience treating paediatric patients on something called tomotherapy, which is a slightly different machine, basically, slightly different treatment technique. There's lots of different places in my department as well that I haven't been to yet. Something called CyberKnife, which is essentially like a robotic treatment for really tiny lesions in the brain and abdomen. But it's all really exciting, and there's so much that I can do and so much to learn still, even though I've qualified from university. It's really important to be able to communicate effectively with people. You're meeting people who've been probably recently told they've got cancer. They've kind of been through a bit of a whirlwind of scans and treatment planning and doctors meetings. And so it's important to be able to communicate in a way that calms them down but gets your message across.
The best bit about therapeutic radiography, in my opinion, is the patients. Everyone's got a different life, a different job, a different set of circumstances, and it's our job to make them feel at ease. Some of our patients come in for treatment Monday to Friday, every day, so you really get to build a relationship with them. It really is fantastic just to see how people progress and get to be a part of that journey.
Although you might only be seeing them for 15 minutes a day, you have to squeeze all of your kind of kindness and reassurance and everything else, as well as treating their cancer, all into that 15 minutes. And I think it's just such a rewarding part of the job when you see somebody who's maybe coming in for 6 weeks slowly start to relax, start to joke around with you, show you pictures of their children, and they just get to know you and trust you.
You can find out more by going to healthcareers.nhs.uk and searching for therapeutic radiography. As you'll see, you'll need certain qualifications to be a therapeutic radiographer, but you can also become a radiography assistant or imaging support worker. As a newly qualified therapeutic radiographer, you can expect to receive a salary of just under £25,000 a year. Thanks for watching this WOW Show Careers Guide. Check out the resources to help you find out more. Look forward to seeing you again soon. Bye!